Hello, my name is Yoshi Bauer. Welcome to the My Special Needs Connection webinar and podcast series. As a parent of children with special needs and as a professional advocate, I understand the challenge of connecting parents and professionals with the information that they need to serve children and adults with special needs. At My Special Needs Connection, we empower parents and professionals through valuable instruction and insights of experts in the special needs community. We're excited to come alongside you to provide you with information that you need. Let's grow through the exchange of knowledge and the hope of success. Be sure to subscribe to our newsletter and YouTube channel for new releases. Please enjoy our webinars and podcasts.
My name is Bibi Pirayesh. I work as an educational therapist. I've been in private practice in the Los Angeles area for about almost 14 years now. And I came to educational therapy by kind of a unique way, differently maybe than most people. My background, my undergraduate degree is in neuroscience and education. I went into school as a pre-med student, and I was, always really interested in the sciences. But when I got to school, I went to the University of Pittsburgh, and at the time, neuroscience was this kind of new, emerging, exciting field, and Pitt happened to have a really good department, a neuroscience. So I was taking classes there, and then I come from a family of teachers. So I was also just kind of in my liberal arts degree taking classes in education and a few in psychology, etc. And I sort of began to see the link between these fields. At the time, they were not officially linked in any way, but I kept wondering as I went from, one part of campus where we were having our neuroscience classes to the other, we were talking about how the brain learns, not in the way that the neuroscientists were, but in different ways. I just couldn't understand why we weren't linking these fields. And at the time, I don't think that I would have ever thought that, a few years down the line, there would be entire programs in neuroscience and education. So, but again, my real interest was more generally how kids learn. How does learning happen? What is it about learning that maybe we as educators don't know about enough? Because people who go through teacher education are usually learning curriculum. We're not really learning about learning or how it occurs or how it develops or how development happens, etc. So that was my graduate degree. I did my doctorate at Loyola Marymount University, and I was specifically concerned. It was a social justice program, and I was specifically concerned about ways to bring this work into public schools. And unfortunately, what I then kind of learned a lot more about is, how systems work and how the public school system works, and how, even though there is a great deal there that we can also learn from, it's very difficult sometimes to be able to, because the way that the public school system tends to treat learning disability or learning differences is, okay, well, we're going to accommodate for this, and we're going to modify what we need to, and we have IDEA in place, which is great. And in some ways they offer a lot more accommodations and modifications than any private school would, and that's a good thing. But there's not a focus on remediation.
I'm wondering, what is, your definition of remediation?
Sure. So I see remediation as, I think, really the best place the best example to use to talk about it is reading. Not just because reading is sort of the biggest learning disability or the one that's been most researched, but because it's the one that we know how to and again, I'm very wary about using words like disability or fixing, because I do think that kids who kind of fall under that larger umbrella of dyslexia are kids who are just differently wired. And I think that nature had a reason for kind of this different wiring that we see in kids and the neurodiversity that we see. But the truth of the matter is that we live in a world in which you have to be able to read, and if you don't know how to read, you're going to be at a very large disadvantage. And so for now anyway, reading is important. But kids who have a reading difficulty, we know what kind of at its root what that is. It's a sound processing difficulty. These kids are just wired differently. We have fMRI images. We know that the reading circuit that develops, and reading is something that we all learn. It's not intrinsic like language, but the reading circuit that develops in kind of a typical reader doesn't develop in the same way in these kids. And so to me, remediation is actually helping to build those neural pathways. It's to help build that circuitry. So through the kind of cognitive training that we do, through the work that we do, we're building new synapses between neurons and building a new pathway, which is the efficient pathway for reading, so that kids aren't, for example, trying to use memory to read. The reason that I wanted to do this topic was because I do feel that educational therapy is still very unknown to a lot of people. I happen to live in an area in kind of the West Los Angeles area where it is a very established field, and the average teacher, psychologist, pediatrician, etc., knows about the field. But I think that that's a very rare thing. And even though this is there's a national organization and there are educational therapists all over the world, this is not a field that people know about. And so that was part of what I was hoping to be able to talk about, is just what is the field. And I think the best place to start is really with the definition that is given by the Association of Educational Therapists. And I think that's also a really great starting resource for parents who might be interested. The website for the association is aetonline.org. And the way that the association defines the field is, or defines the professional, is an educational therapist is a professional who combines educational and therapeutic approaches for evaluation, remediation, case management, and communication and advocacy on behalf of children, adolescents, and adults with learning disabilities or learning problems. And I think there's a lot in there that sort of needs to get unpacked. The first of which being this idea of educational and therapeutic approaches. So the term itself, educational therapy, when we talk about occupational therapy, which is really concerned with motor development, or speech language therapy, which is really concerned with language development in children, educational therapy oftentimes comes after that. So a lot of my referrals do come from OTs and speech language pathologists, because these systems develop, kind of lay on top of each other in the brain. And so if there's difficulties in those earlier stages with motor issues or language issues, oftentimes that will create problems down the line for students. So, but there is a therapeutic component. One, because it's a clinical practice. You're concerned with remediation, and two, because and this is one of the things that I love about the field, and one of the things that attracted me to it. It's really about seeing the whole child, and about seeing the whole child in their environments. Research is showing us more and more every day how much emotions mediate learning. and what a big role kind of the social, emotional, psychological place that a student is in and what's happening to them in their life and in their environment impacts their learning. So these are things that a well-trained, good educational therapist is aware of, and can can really use to the student's advantage. And so I think that's one aspect of the field that really places the ed therapist, I think, in some ways, at the center. The case management part of the field is really about being that person that knows the language of the school, knows the language of the assessor, knows the language of the psychologist, knows the language of the parents, and then knows the language of the kid. And so is kind of the epicenter when it comes to what we call the treatment alliance for that child. And I think that that's a really big part of what I do and what therapists do. And then there is, in terms of the evaluation piece, I'm a big believer in evaluation. Obviously, not all ed therapists do testing, but the ones that do ed therapists are, when they get trained, they are able to do the same level of testing as as a school psychologist, but if they're trained in it, they can't do the type of testing that a clinical psychologist would do. But not all kids need that. Not all kids need a full neuropsych evaluation. So that and regardless of whether you do kind of formal testing or not, any kind of remediation plan has to begin with some kind of baseline evaluation so that you know where your student is and what's going on with them. And then, as I talked about earlier, remediation is a big part of the work. And then, of course, advocacy on the part of the family and of the child, because a lot of times, again, it varies from family to family. Some people might have an educational advocate, which is like a separate person, but whether the kind of advocacy that needs to happen, like the kind of advocacy that I do, is less in IEP meetings or with kind of school leader at the school leadership level. It's more the kind of advocacy that happens day to day with a teacher for students. So like, so I'll give you a very recent example. I was having a meeting with a science teacher who, was saying that the student that we were talking about is just not doing the work, and is just, if she only comes in and gets help, and if she does the work, etc., everything will be fine. And the advocacy that I had to do on behalf of that student was to try and help this teacher understand that she's not being lazy, she's not being insubordinate, she really doesn't get it. And that was just something that was not, she just couldn't understand when I would kind of try to explain it more clinically. So then I said something, because they were doing a unit on reproduction. And I explained to her that this student, I had just worked with her. And when we came to the word reproduction, this is a middle school science class. Mm-hmm. When it came to the word reproduction, she thought the word reproduction meant defecation. And so just for that teacher to be able to understand where the student is compared to what it is that they are asking and expecting, I mean, that was like a huge aha moment. Like, oh my God, I had no idea that she doesn't even have this vocabulary, that she doesn't even have this language. And I think that helped her to really kind of take a step back and not be so, because a lot of times defenses come up, I think, for teachers or for parents, because they think that the other person is being difficult or just not holding up their end. Mm-hmm. And understanding that there's, for example, in this case, there's a very severe language issue going on. That helps to calm some of those tensions. And so that's, I think, the kind of advocacy, for me anyway, that I'm constantly doing for students. Because students are not able to do that work for themselves, because they don't have the language, and they often don't even know, they're for example, this student might be missing 70% of what's coming at her, we can't expect her to be the one to go and speak up and say all that. And so I think that is also a big part of what an educational therapist does. You're really the middle person between school and home and family. And very, similar things also happen, with parents, like helping parents better understand why their child is doing what why they're seeing what they're seeing with their child, and that it's not a behavior issue or laziness or these kind of things that we typically think of. But another way that I kind of try to explain to parents, because I get this question a lot, like what is it that you do, and what is this, and how is this different from tutoring? She's had a tutor for X number of years. So I usually use, there are different metaphors that you can use, but I use the metaphor of a tree a lot, where I say to parents that, think about a tree. The academics, so what happens in school, are the leaves for the tree. And when we begin to see issues, what's going on with the leaves of a tree, we don't say, okay, well, I'm gonna spray the tree leaves differently. I'm gonna trim the tree leaves differently. We don't think that way. We think, well, what's going on with the roots? What's going on underneath? What's creating the symptom that we see in the leaves? And it's very similar, in terms of learning. The type of academic learning that we expect kids to do at the school level is like the leaves of the tree. So when their grades start to fall, or when they're not able to like read at grade level, or whatever the issue that's going on, that's a symptom. And we need to look underneath and see what is going on at the root level. And that's where kind of this processing skills view of learning comes up. So, that's really where I see that's where the educational therapist needs to intervene, at the processing skills level. So we all have, whatever you want to call them, processing skills, learning skills, neurodevelopmental constructs, whatever you want to call them. They're the underlying skills for learning. So things like memory, attention, your visual processing abilities, auditory processing abilities, logic and reasoning, all of these kind of underlying things that need to be in place and working in order for you to do academics. And so, when people say, okay, well, how's it different from tutoring? Well, tutoring is just tending to the leaves. Tutoring is often, it's great, but a tutor is helping you with content that maybe you didn't understand, or maybe that you missed. But oftentimes the approach is very similar to what happens in the classroom and with teachers. It's based on the curriculum, whereas educational therapy is based on the students' learning. It's based on their development. And so my job, for example, if a student is, having trouble, I don't know, memorizing facts for a history test or something, I'm not going to go in there and teach them history facts. I'm going to go in there and try to see where their memory capacity is, and we're going to target that, and we're going to increase their sort of the digit span, their memory capacity, piece by piece, until they get to the place where they're capable of memorizing, doing the task that's expected of them at school.
Right.
So
And that skill is probably going to help them in so many other areas as well.
Exactly. So, once you begin to build these capacities, it generalizes, and the student, it's, a big part of the work is also helping students demystify their own learning and understand how their own strengths and weaknesses and where they need to work more. And then, improving that learning capacity so that they can just be better students in general. So it's not like, okay, we're gonna work on history until you get an A on your history test, which is oftentimes what happens when you work, with a tutor, etc. So that's really the view that I take. Now I know that maybe not all therapists do it that way. I think a lot of people come to this field, with a background in reading, because reading remediation is really, it's a very big part of the work, and it's the part. I mean, I think executive function more and more is becoming one, but reading remediation is usually the thing that parents freak out about most and want their kid. It's the thing that shows most, right, when a
Right.
student read. And it's like any other field. I mean, and if you go to a doctor, different doctors specialize in different things. So people might specialize in different things, but I really believe that an educational therapist is someone who understands the overall of learning, and how all these processing skills are important to the learning of students, and how strengthening them is really important for learning in general.
Wow.
So that's kind of a little bit of a background. Now, when these processing skills break down, depending on how they cluster, we have given different names to those clusters. So, ADHD, or a specific learning disability in math or in reading or in whatever it is. Different kinds of languages. I mean, there's whether you follow kind of the DSM or you follow the language of the public school systems, we usually have a diagnosis, and then from that diagnosis we kind of try to figure out what's going on. Although I do want to say, this is another really important point that I want to make, especially for people whose children attend public schools. I think one of the things that happens a lot is children, the children who are severely impacted enough to get a diagnosis, because you have to also understand that the bar, unfortunately, is pretty low for that diagnosis in the public school system, because it's all about, it's about money and all of these other issues. So it is very possible that your child does not qualify for for anything after testing, but they are still very much not where they need to be. So there's this whole gray area between, having a diagnosis or having an IEP or having a 504, whatever it is, and being a typically functioning kid. And I think that that's another place where a therapist can be very effective, because there's so many children who are not so severely impacted that they would qualify for those things, but whose processing skills are not at all where they need to be. And then I also want to just touch on when and how you can ask for this kind of help. um, you know Depending on where people are listening from, like I said, a lot of the because of the work of individual educational therapists like me, a lot of independent schools now do have learning specialists, people like that. But if they don't, it is a good idea, if you're in the private school system, to ask about educational therapy. If you're in the public school system and you're kind of navigating that whole system, I think it's, again, something to think about if it is something that you can afford, or if you're in a position, there are definitely a lot of great groups and foundations that will help support educational therapy or assessment, et cetera, for students who need it but who can't necessarily afford it. But I think that it's something for parents to look into if the answers that they're getting from their school system doesn't quite fit. And they need someone to really help them navigate what is going on with their child's learning. It's something that I think oftentimes parents don't even know who to go to. I mean, parents trust the school system. This is not something that's part of the school system. Parents, pediatricians, and that's another place where parents go for help. They don't really know about it very much. And so students, I guess you could say, cognitive health is just something that we don't really talk about. And we just refer to the school system for help, but they don't come at it in this way. And so I think that generally speaking, an educational therapist is the person that you go to if you're feeling like there's something going on with your kids' learning that isn't quite working as it should.
My first question is, if I'm a parent who has a child who's struggling in this area, and I come into you and I'm really lost, what are just some quick fire things that I should know about your profession?
Um, so I think the first thing that you need to know is that it's not something that's going to get recommended to you because people don't know about it. The second thing that you should know is that it is something that can be of immense help. So you should get to know about it.
Right.
I think the website, the Association of Vet Therapists website is a good starting place. There's also a lot of great resources, like the site that you guys have, where people can get information. Understood.org, I think, is a really great starting point as well. And I think that one of the things that you have to do as a parent is to begin to ask about it. You should put that language out there. Can you tell me about educational therapy? People that the school systems or maybe pediatricians, psychologists might know about more are speech language pathologists or occupational therapists. And then oftentimes those professionals know educational therapists. So that would be another way to kind of get to an ET in your area. And then I would say, like with anything else, always do your research. I mean, just because someone isn't a therapist doesn't mean that they're going to be a great one. So, do your research, make sure that it's the right fits, learn about their background. Other places, there are a lot of centers now where they work with reading, like for example, Linda Mood Bell. So if you have access to those types of centers, that would be a place maybe to ask about an educational therapist who can kind of widen the lens. And so we're not just talking about reading necessarily, but we're talking about all of the learning issues that might be going on. And then lastly, I think for people who are getting assessments done outside of the school system, so getting a neuropsych evaluation done, which is not necessarily something that every child needs, but people do get them. That would be another resource, to kind of get referrals for a therapist.
Awesome, thank you. My next question would be, how how early should parents seek help? And I know that that's obviously like that depends totally on the specifics of the child, but maybe like
Yeah.
overarching theme of when they should come.
I think, like I said, I always tell parents, no one knows your kid like you do. Trust your gut. I cannot tell you the number of parents who walk in through my door and say, I knew something was wrong all along, and I kept going to the school, and they kept saying to me, it's okay, they're going to develop in time. Everyone reads at a different pace, etc. I think parents know. Don't ignore the signs. I think that especially around reading, when it comes to things like the phonological awareness that is the underlying kind of cause of reading disorders, that's something that you can figure out with a simple screening very early on, and I don't know why we don't do that. But I would generally say that if after a year of instruction, your child, for example, when it comes to reading, if after a year of instruction in reading, they still don't know their letters or can't do their sounds or aren't where they need to be, you should you should start some kind of process. Now, keep in mind that, especially now with the changes that we've had, what I also see happen in the public school system is parents go and they kind of bring it up to the teachers, or sometimes teachers are the ones who pick up on something. And then we spend a year, with, these SST meetings and, everyone's meeting about the kid and what's happening. And of course, the school system can't ever recommend testing or intervention outside of school to a parent. They're not legally allowed to. So an entire year passes and that child doesn't get remediation at the necessary level, at the targeted level. So they might be like, okay, well, we're going to have these meetings, and then over the next 6 weeks, we're going to see how they progress with like 20 minutes of intervention with the resource teacher or their teacher or their classroom teacher. But that intervention is not happening. You know, maybe they're working on words when they really need to be working on sounds. So those people are not trained in doing that work. Or there might actually be, let's say, an auditory processing disorder, something going on that is going to prevent that child from kind of getting better in that particular amount of time. And then it takes an entire year before they say, okay, well, maybe we need something more serious. And I think that parents will save themselves and their child a lot of time and trouble if they don't necessarily follow the recommendations of the school system. All of that can happen, but you can get outside help when you feel like something is not working. I think the first thing that you need to kind of realize is that parenting is difficult. Parenting in today's world is especially difficult. Parenting a child with a special need is very difficult. So I think the first thing that parents need to do is to just cut themselves a little bit of slack. And then I think that after that, then you need to kind of cut your child a little bit of slack, because we just inadvertently, like without meaning to, we're just constantly going to be comparing our child to typical development and typical behavior.
Absolutely.
And when we see that, it can be really frustrating and really confusing. And then on the other hand, I think it's difficult for parents to want to sit and think, okay, well, there's something there's something going on with my child's brain. Like this is happening at a very different and real level. That can also be difficult. But I think that you just have to constantly remind yourself that, and this is something that even I have to do, that you're working with a different kind of raw material than with a typically developing child. And so you have to be, the level of patience and the level of understanding, mostly because of parents are not specialists. They're not specialists in how all this stuff happens. So for them, it's a really big shift and a really big leap. So just, I would say, be patient with yourself and just understand that you're dealing not with a typical situation. And so hopefully that should help bring down frustration a little bit. Because I think the most frustrating thing for parents is when their child can't do things that you just expect anyone to be able to do.
Right.
And then it rolls into this whole like, oh, well, they're doing it on purpose. And that's not the case.
My final question would be, do you have any stories of triumph or success from any of your clients or patients that you would be comfortable sharing, just to give a little bit of encouragement to our listeners?
Yeah. There's so many. Yeah. One of the recent ones was the one that I already shared. Another one, I think one of the most joyous moments for me with any student is if I have a student who has a reading difficulty, and the moment that cracking of the code happens, the moment that they begin to see it and put it together, that's always just an incredible moment. And it's one of the reasons why I love my job so much, because you can see the result of your effort right in front of your eyes. But if I had to pick a specific kind of recent, this isn't something that we normally think about as a success, but I do think it's important. I had a student who I really felt, not that she was misdiagnosed, but I really felt that the entire diagnosis, the entire picture didn't come up in the testing that was done. And so the assessment that was done had certain diagnoses, and these were the parts that we were working on. But in my work with her, I was seeing that there's more going on and more going on. And so I insisted on reaching out to the neuropsychologist who did the assessment. And then in our conversations, it really became apparent that even though she didn't, by the numbers quite fit the sort of ASD diagnosis that I was thinking about, that there are representations there that we really needed to address. And so, beginning now with this new map, we were able to get her into a different school and get her a different level of services that I think really helped bring the stress levels in the family down 1,000 notches, and really just helped everyone feel a lot better in terms of the work that we were doing. So I think, it's not usually what we think of as a story of success, because it was actually about getting an additional not diagnosis, but thinking about it with an additional diagnosis in mind. But sometimes that's what it takes. And sometimes you're in the work and you're in the trenches and you're doing everything and it's not quite working, and sometimes it's because you have the wrong map. And that's another place where I think, as an ed therapist, I try to trust my gut, and it paid off.
Thank you again. It was truly my pleasure. And yeah, I hope you have a good rest of your day.
Thank you. You as well.